what this pandemic has done is it's forced healthcare
Yes.
to change. There's no choice.
Yes.
And so my question is, do you think that creates a change mindset that is going to persist? That healthcare, that doctors, private practice, big systems, whatever, are going to be more open to changing the way they do things, even let's say after the pandemic is passed? Do you think they're going to remain more open to change than they were beforehand because of
I'll
the
give you
experience?
one real quick answer and then go back to the ladies. Our patients will not go back to accepting what they did in the past. And my doctors all realize that. They said now they're going to say, well, boy, the last time I was here, I was in and out in 40 minutes. That is unheard of in ophthalmology. They're not going to accept it. So we have to adapt,
Right.
because they now know that we can do it if we're willing to adapt.
I mean, I think you're right on that aspect. I think that, in the past, I mean, we typically run on schedule, but running on schedule sometimes could also mean that a patient waited in the waiting room for 25 minutes. And, it's now that's not happening. And I think that patients are getting a sense that, they can come in, they can have in their visits and leave, and they're not sitting for an extended period of time in a waiting room full of people. And I think that moving forward, I don't think that patients are going to be happy sitting in a waiting room full of people when they've had, 8, 9, 10 months of experiencing, going into the office, getting the care and leaving.
Mm-hmm.
I agree. I think the pace for change here was so rapid, and we were able to do it even across a big organization. And I think we proved to ourselves we could. And so now no one wants to go back and prove we can't. And what we are proving we can do fast is what the patients want. And we're hearing and seeing that. And so I think it was maybe not the way we would have wanted it, but it was probably the perfect disruptor to start thinking about how to deliver healthcare differently.
Yeah.